but just think about the folks that you may adversely impact unknowingly by being careless. This is a time to hunker down, Hoosiers, and play by the rules. That's what we do. And as a team, together, we're going to remain Indiana strong.
Right now at 6 o'clock, Governor Holcomb addressing what's expected to be a surge in coronavirus cases across the state. Good evening, everyone. I'm Brooke Martin.
Thank you for joining us tonight. I'm Phil Sanchez. The surge in coronavirus patients expected to hit the state as early as mid-April. We have live team coverage tonight, and we want to begin with our Richard Essex. And Richard, the state wants to double the number of ICU beds currently available.
Well, the state has been working on a plan for this coming surge in patients for about 3 weeks to accommodate the expected load on our healthcare system. Just about every available bed in the state is being prepared. 3 weeks ago, Franciscan Hospital admitted their first COVID-19 patient. Today, they have close to 100 patients in the hospital with the virus or suspected to have the virus. Franciscan is part of the 5 central Indiana hospitals that is preparing for the worst. As of today, there are just under 2,000 ICU rooms and 1,100 ventilators statewide, and the number is expected to double those in the coming weeks. Which is being done by ending elective surgeries, using recovery rooms, surgery centers, emergency rooms, and in some cases maternity wards as ICU rooms. Staffing for these rooms is another challenge. The state has temporarily eased or removed license requirements to allow retired healthcare professionals to come back to work.
Respiratory therapy teams are being stressed, of course, in the midst of this, but critical care nursing is a big area of need. And we're kind of putting out the all hands on deck call so that, if and when that surge really does materialize in the next 2 to 3 weeks, that we would have, sufficient resources to help support the critical care needs, including managing those ventilators.
So far, 5,300 former healthcare professionals have volunteered to come back to work. Fourth-year medical students and nursing students are also being encouraged to volunteer. As of right now, the state has not built any field hospitals. They say that they have plenty of rooms that are being prepared right now. Now, the governor has authorized the reopening of a couple of hospitals that have closed. He says that given the current trends, we have enough space to handle the expected surge. In downtown Indianapolis, Richard Essex, Wish TV, News 8.
Well, I was very scared of who maybe I had exposed.
A woman just released from a hospital bed now sharing her experience. The Johnson County woman has been dealing with coronavirus symptoms for the past 2 weeks. News 8's Sierra Hignite sat down with her to hear what it's been like.
Amanda Wood's symptoms got so bad that she found herself here at Community South Hospital. And it's inside these walls that the thought first crossed her mind that she might never see her family again. Amanda Wood travels often for her job. The first week of March, she flew to Arizona, and the next week she flew to Baltimore.
So I came home on Wednesday of that week, and by Saturday I was showing symptoms.
When her symptoms started on March 14th, she knew she was sick, but could not have predicted what was to come.
I literally felt like I was dying. It started with just a runny nose, and I had that for a couple of hours, and then my body just hurt. And it was a hurt that I just can't explain. Not the normal flu hurt, but it just where I couldn't even hardly move.
She called her doctor, and they suspected she picked up the virus while in Baltimore or on the plane ride back. She couldn't get a test at the time, so she self-isolated, and after a week, she thought she was on the mend.
Then by that following Tuesday, it was like it was starting all over again, and it got to the point where I felt literally like I was drowning. My lungs felt like they were drowning.
Her husband rushed her to the hospital. He wasn't allowed to go in with her. Once she was admitted, her CT scan confirmed her assumptions before her test ever came back positive. Her worst fears started to become a possibility.
When you're there, you're scared that you're going to die and you're not going to say goodbye to your family, and no one's going to be around you when you die.
Doctors told her that if her oxygen levels would have dropped any more, she would have to be put on a ventilator. Wood was able to recover enough to be able to come home. She thought the hardest part was over, but now her quarantine continues and she's met with a new challenge.
The worst part is hearing my family out there and not being able to be with them and see them, and I want to hug them so bad because, I mean, I just had the scare of my life, you know, and I can't hug them.
Amanda did have to start her quarantine over once she got home from the hospital on Friday. Once her 14 days are up, she will be able to start transitioning back in to her new normal. Reporting on the South Side, I'm Sierra Hignite, Wish TV, News 8.
Sierra, thank you very much. Well, that woman just one of hundreds of Hoosiers to have tested positive. The Indiana State Department of Health has now confirmed nearly 1,800 cases. Some 11,000 people have tested. The death toll also continues to rise. A total of 35 Hoosiers have now died from the coronavirus. On Sunday, U.S. Surgeon General Dr. Jerome Adams called Indianapolis an emerging hotspot for the virus. Governor Eric Holcomb talked about that this afternoon.
It just goes to prove that you don't have to live here to look at the numbers and track the numbers. And I appreciate their whole federal team with eyes on every single state. And it just underscores what Dr. Box just mentioned, that we need everyone to be playing by the rules so we can play through this.
The hotspot designation is due to the rising number of cases, and state health leaders say you can expect that number to continue to rise as more people are tested. So can we expect drive-through testing for the general public anytime soon? News 8's David Williams went looking for answers.
You can get a COVID-19 test in Indianapolis via a drive-through at Eli Lilly, but that's limited to first responders and active healthcare workers. Today, we spoke with several area county health departments. Here's what we've learned. Several county health departments told me they don't have plans to set up drive-through COVID-19 testing at this time. Marion County Health Department told me they're exploring the possibility of providing drive-through testing. Morgan County health officials say they don't have drive-through testing plans, nor do they have COVID-19 test kits at this time. Hendricks County Health Department tells News 8 they are planning on drive-through testing, but do not have test kits yet or guidance from the state. Earlier this month, President Trump said they were considering more drive-through and walk-through COVID-19 testing sites in states hit hardest by the virus. Today, the state's new Joint Information Center told News 8 every state has experienced challenges getting testing supplies. ISDH has been working diligently to expand testing through partnerships with Eli Lilly and the addition of other labs. The number of tests reported to ISDH has increased tenfold in recent weeks. All drive-through test events have been run at the local level and are dependent on local resources. We will, of course, stay on top of this story and keep you updated. In Indianapolis, I'm David Williams, Wish TV, News 8.
David, thank you. Meanwhile, President Trump is defending his decision to extend the social distancing guidelines through the end of April. Earlier this month, the president told Americans to stay home for 15 days, but yesterday he extended that plan to April 30th. President Trump and his task force spoke with the nation's governors today, telling them the virus is still several weeks away from peaking. We spoke with Indiana Republican Senator Mike Braun about the White House's response today. He says the more we learn about the spread, the easier it will be to decide when to lift restrictions.
I say stick with it. We've invested 3 to 4 weeks in the guidelines that the health experts have told us to. We don't want to backslide. And I think
the current guidelines recommend against group gatherings larger than 10. They also urge older people and anyone with existing health problems to stay home.
Well, Governor Eric Holcomb also signing another executive order today designed to help stop the spread of the virus. It does 3 things. It clarifies the prohibition of elective surgeries, procedures in an effort to preserve personal equipment, protective equipment, I should say. It also allows for the temporary authorization of retired medical professionals and medical students to practice. And finally, it provides the state health commissioner with the authority to reopen closed hospitals if needed.
Good question. Well, health officials reported in previous studies that pregnant women infected with COVID-19 could not infect their babies in the womb. But new evidence is suggesting something different here. Very interesting. Wish TV's medical reporter, Dr. Mary Gillis, is here to give us an update. Can you talk about this new research, Mary?
Sure. So early on, there was no evidence that coronavirus crossed the placenta. Health experts continue to reassure the public and that newborns could only contract the virus during or after delivery because of all the body fluids involved in labor. So this was encouraging for those not only who are pregnant, but also considering starting a family. But things have changed. So
so what does this mean? Yeah, for pregnant women.
So there was a recent study that came out from the American Medical Association suggests that this virus can actually cross the placenta. So Wuhan Children's Hospital evaluated 33 newborns born to mothers infected with COVID-19. 3 of these newborns were found to be infected even though doctors followed protocol and nurses followed protocol in terms of sterilization. They isolated the newborns immediately. I will say all of the babies are fine. They survived. They recovered because of being on a respirator and antibiotics. But the researchers had to conclude that this had to be transmitted in utero. And this is what they called vertical transmission. And this is when a mother directly infects a child with a disease.
Okay, so we're starting to get some new information, and that's kind of been this virus as a whole, is that it's a little disconcerting because things change every day, every week. So this is a good update that we'll continue to follow.
Thanks, Brooke.
Thanks, Mary.
All right, ladies, thank you very much. The local shipping company is saying thank you to truck drivers. Spot Freight visited the Aldi distribution center in Greenwood today. They gave out free lunches to drivers waiting to have their truck loaded to make deliveries to Aldi stores. Truck drivers are among those on the front lines of the coronavirus pandemic response efforts, making sure that stores have the food and other supplies they need to help the customers.
I think just being here and showing them that we care, because a lot of people, I think, they don't understand what truck drivers are doing right now, but they're really keeping the nation moving at this time. And for someone to come out here, give them like a lunch, like I said, and tell them thank you, I think is really, it means a lot to them.
Over the last few weeks, truck drivers have been working long hours, making deliveries across the country. Our coverage of the coronavirus outbreak continues online at wishtv.com. There, we've created a special section full of everything that you need to know, including the latest on the cases here in Indiana, the stay-at-home order, and much more. That's all online right now at wishtv.com.